Hey everybody, today I am going to be speaking with you about scars and stretch marks. My name is Dr. Anthony Yoon, America's holistic beauty doc, and we're going to talk about questions that I get all the time. How do I treat scars? How do I make my scars look better? How do I heal better from surgery? As well as what do I do with stretch marks? So scars and stretch marks are an issue that so many people have. There are things you can do, and unfortunately, there are limits to what you can do with them as well. Also, if you are watching today and if you've got questions, feel free to leave those questions as a comment, and I will do my best to get to them at the end of this broadcast. So let's start off talking about scars. You know, I perform a lot of plastic surgery, and plastic surgery does create scars. Scars are permanent. They never 100% disappear. Back when I was in my training, I had a nurse tell me once that, you remind me of the surgeon that I work with who's the best surgeon ever. He doesn't leave any scars behind. That surgeon is somebody who doesn't exist. You cannot operate and not create scars. So scars are permanent no matter what. There are things, however, we can do that can help make the scars look as good as possible. So the first thing are scar creams. There's a lot of scar creams on the market out there. What do you buy? Well, there are studies that have looked at scar creams, and they have typically found that silicone-based scar creams, like the one that we have in our office called Silagen, work better than non-silicone scar creams. So for example, there's a very popular one out there called Mederma. Mederma was based off of a scar cream in Europe called Contractivex. And that scar cream in Europe had a combination of heparin with an onion extract. When they brought it to the US, because heparin is a medication, they took the heparin out of it, and now it's just based off of an onion extract as far as I know. That does not compare very favorably to a silicone-based scar cream. So ideally, if you've got a scar, especially if it's a new scar, then I would recommend you use a silicone-based scar cream for that. You can also use silicone sheeting. That's also a reasonable option too. Silicone sheeting has been tested against silicone scar creams and have had fairly similar results. One caveat is that if you are using a silicone-based scar cream, make sure it leaves behind a film, because the idea behind the silicone is that it creates this what do we call it? It's a covering basically over the wound, over the scar, and we believe that by preventing it from being exposed to air and the other elements, that helps it to heal better. Okay, so first step, if you've got a scar, use a silicone-based scar cream. Secondly, if that doesn't do it, and I usually recommend to use the creams in Caucasian patients starting at using it for about 4 months, maybe longer if needed. For my patients who have darker skin, who are at a higher risk of a darker and a thicker scar, I usually recommend for them to use it 6 months, sometimes longer, even up to a year, because it can take that long for the scars to mature. All right, so you're using your scar creams, and a month or 2 months later, the scar starts to look a bit thick. What do you do? The second thing that I recommend, or the next step, would be laser treatments. So there are a wide variety of lasers out there. The one that has probably been tested for scars the most are pulse dye lasers. Pulse dye lasers target the color red, and they can help decrease the redness of a scar. And so that's one to consider. You can also consider using intense pulse light. You may even consider using an ND-YAG laser. There's a lot of lasers out there that you can try for scars. We also use a 1540. It's called a 1540 icon laser, and we use that for scars as well, and have had some pretty good results with that. So if, let's say, the scar creams aren't doing it, next step would be to use a laser treatment. That you obviously would need to get from a doctor in a doctor's office. In my practice, when I do surgery on a patient, because we have a plethora of lasers available, we do it complimentary. Okay, if it's long-term, sometimes we will bill it to insurance if it's dealing with a keloid, but otherwise it's something that we are happy to offer our patients. All right, if you do have questions, feel free to leave them here as a comment, and at the end of the broadcast, I'll try to get to as many of those as possible. All right, so let's say you're doing your scar creams, you do your laser treatments, and the scar still isn't quite doing it. The next step after that are injections, okay? And typically what we inject for scars are steroids. And the one that we start with is called Kenalog. Kenalog is triamcinolone, and it comes in 3 different strengths. Excuse me. There's a live video for you. It comes in 3 different strengths: Kenalog 10, Kenalog 20, and Kenalog 40. Most of the time we start with Kenalog 10, or I will even sometimes dilute that down a bit. If the Kenalog 10 injections don't work, and we usually do it once a month, okay, then we do Kenalog 20. If that doesn't work, then we hit them with the tough stuff, Kenalog 40. Now, the reason why we don't do Kenalog on all of our patients, and we really pick and choose who we do it on, is because there are potential side effects of it. You can get thinning of the skin around the tissue with the steroid injection. And if that happens, there's really no way to reverse it. Okay, so we only use Kenalog or steroid injections when the scarring is getting thick. All right, and if you're having surgery, your surgeon should know how to inject Kenalog. It's a very basic thing. So once again, here we go. Scar creams, lasers, Kenalog treatments. If the Kenalog treatments aren't doing it, now you've got a real scar problem, okay? And there are a couple of options. 5-fluorouracil is something that some plastic surgeons and dermatologists will inject into a scar that can help break down the scar tissue. I almost never go to that. It's usually not needed. The other thing would be to consider another surgery. You can cut that scar out and restart over again. The problem with that is that there is a high risk that scar will come back. Okay, if it's a thick scar, you cut it out, there's a good chance it will come back. So you only do that when you really don't have many other options. And the final thing with scars is if you remove scars and they keep coming back thick, your salvage procedure is radiation. So there are dermatologists and radiation oncologists who do have access to very low dose superficial radiation that you can use on keloids and other scars. This is especially if you've got a true keloid, a keloid that's a really thick scar that just keeps coming back. Sometimes surgery to remove that scar, and then typically the next day you do, and once a day for the next 3 days, you do radiation session each day. And that usually works to prevent a scar from the keloid from coming back. The problem with that, however, is it's freaking radiation, and who wants radiation? It is very limited on the amount of radiation that you get, but it still is radiation. So it's not something that you ideally want to use. In my practice over the last 15 years, I think we have used it maybe 3 times. I can remember 2, but maybe 3 times. So those are the treatments for scars, thick scarring. There was a question on acne scarring. Acne scarring is very different. If you have acne pitted scarring, that is very, very difficult to treat. Okay, and that type of scarring is usually best treated with resurfacing, whether it's multiple chemical peels. Back in the olden days, they would use dermabrasion to sand the skin down. You can use ideally like a fractional CO2 laser that can help with it. If it's not that bad, you could even try microneedling. And we are starting something here called gold microinfusion microneedling that I'd be really curious to see how that does with acne-based scarring. So that's how you treat scarring in a nutshell. Scar creams, laser treatments, steroid injections, and then if that doesn't work, then you've got 5-fluorouracil, you've got surgery and or radiation therapy, okay? Now let's talk briefly about stretch marks. Stretch marks, so many of us have stretch marks. Obviously, we see it most commonly in people who've gained a lot of weight very quickly, or in women who've had children. You get stretch marks in your tummy. But a lot of us get stretch marks even when we're just growing up and we're going through our growth spurts. I have some stretch marks from just growing up. So how do you treat it? Well, the first thing is if it's a new stretch mark, okay, laser treatments can definitely help. We've used pulse dye laser treatments. We have an Icon 1540 laser. Ideally, if you've got a new scar that is red, then a pulse dye laser can help with decreasing that redness. You typically do those treatments once a month. We have seen that in patients who've had breast augmentation. Not common, probably 1% or less, where women have breast augmentation, they develop stretch marks on their breasts. We very quickly then start them with laser treatments with the pulse dye type lasers. You can also use an IPL for that. And once again, you can use a fractional laser too. If, however, if it's a young scar, that's what you want to start with, either like an IPL or a pulse dye laser. If it's an older stretch mark, so not scar, stretch mark, then what I would recommend treating that with is something stronger. So a pulse dye laser is not going to be great, or IPL is not going to be great for an old stretch mark that basically are tears in the dermis of the skin. For that type of a old stretch mark that feels real thin on the surface of the skin and kind of wrinkly, you need to do something stronger. The only FDA-approved fractional laser for stretch marks is the Icon 1540, and we have it here in our office. It is a fractional, non-ablative laser, so there's very little, if no, downtime with it. And what that does, it helps to contract and tighten the collagen, which can help with making that stretch mark less thin and a bit thicker, okay? Not as good with an early or a new stretch mark, but for one that's been there for many years, if you want to reduce the appearance of it, then you can consider that. Some people are trying some other things, like microneedling for stretch marks. That might help some. Some people have done chemical peels for stretch marks. That's not my favorite. I do think that right now, treating them, nothing is great for stretch marks, but if you're going to do it, then a fractional laser is what I would recommend starting with. There are some new things with microinfusion, microneedling, which may help with that too, but we haven't tested that out yet, so I can't tell you yay or nay with that. The other option for stretch marks is to cut those stretch marks out. So that's what we do a lot with tummy tucks, and that's obviously super effective. All right, so that is my treatment protocol for scars and stretch marks. We have got some questions here that I am going to answer. Let me get to the most early ones. Hello to Brenda, to Annie. Sam says, I have bad acne scars, quite deep, tried everything, help. Acne scars, I mentioned earlier, very difficult to treat. You really have to consider some type of an ablative or resurfacing treatment, like fractional laser, deeper chemical peels, that type of thing. Parveen says, I'm covered in stretch marks and have been for many years. Is there any hope of really smoothing and reducing them? Very difficult with stretch marks. What I would recommend is considering a non-ablative fractional laser in smaller areas. You can try that in the smaller areas, see how it does before you sign on for a lot of it. Do some test spots and see how that does. Let's see here. Annie says, I had a C-section 21 years ago. My scar does itch constantly. What can I do? For an itchy scar, if it's thick, sometimes literally just injecting some steroid into that scar can really settle it down and definitely decrease your symptoms, even potentially in an older scar. So I would encourage you to see a dermatologist and see if they'd be willing to inject that scar with some steroid if they think that that may help you. Araceli speaks in Spanish, and my Spanish is pretty rudimentary, so I can't answer that. Christy says, autophagy from fasting helps scar healing and stretch marks. So hopefully I answered that question. Intermittent fasting, autophagy, a lot to it, more than what we can answer in this video. Would encourage you to take a peek at some of my other videos. We have one on the fasting mimicking diet. If you check my YouTube page, youtube.com/ I think it's user/TonyYoonMD. There's a really good, interesting video on autophagy and the fasting mimicking diet. So I would encourage you to take a peek at that. Karen, we got some questions that you have?
You answered them.
We're good? All right. So I hope that this answers your questions on this stuff. Scars and stretch marks are really a tough issue for so many people, but hopefully this gives you a nice guideline of how to start treating them. Obviously, feel free, send me questions as comments. Ideally not direct messages, but usually comments we answer much more quickly, and I appreciate you watching. My name is Dr. Anthony Yoon, America's Holistic Beauty Doc. Have a great day, everybody. Thank you so much for watching.